Part 2, location plans. Now these plans are demographically assigned. So if you are outside of Sonoma County, the number of plans that are available could vary just a little bit. Here in Sonoma County, we do have 3 Medicare Advantage plans available. Those premiums range from a $0 per month premium to $78 a month. We have 25 Medigap or Medicare supplement plans ranging from $61 to $232, and your Part D prescription drug plans, we have 22 prescription drug plans that range from $15 to $115. Now a Medicare Advantage plan, there is a $40 per month premium, and this is a network-based plan. As we mentioned before, it is a PPO network. Your doctor copay is a $15 copay. To a specialist, it would be $25. If you end up in the hospital, under this plan, you would pay $775 copay for each hospital stay. The prescriptions start at a $7 copay for your generics and go up to 33%. Now a Medigap, we have chosen a Medigap Plan F. That is sort of the Cadillac of the Medigap plans. It's one of our most popular plans, and to it we've added a prescription drug plan. The monthly premium for your Medigap Plan F is $167. To that we add a prescription drug plan at $48 per month. So your total monthly premiums would be $215. Now, as I mentioned before, remember, we don't have a network, so you can go to any doctor or any facility that accepts Medicare nationwide. You won't have a deductible. If you go to the doctor, you don't have any copays. You don't have a copay if you go to the hospital. You simply check in, check out, and go home. Basically, a Plan F does cover all of your Medicare-covered services. Your standalone prescription drug plan has a $0 deductible and starts with a $4 copay for those generics and goes up to 33% for your specialty drugs. Under Medicare, your prescription drug plan will have 3 different levels. The first is your initial coverage. The vast majority of you will never leave this initial coverage phase. This phase is simply when you enroll in a prescription drug plan, you pick up your prescription, and you will pay a copay for that. Now the copay is not the full retail cost. It's a reduced cost because you have a prescription plan. The full retail cost of your prescription is being tallied, because when that retail cost reaches $2,930, you leave your initial coverage phase and then go into a phase that we call the coverage gap or the donut hole. You will then pay 50% of the full retail cost of your brand drugs. The pharmaceutical company is actually picking up the other 50%, and this will continue until the combined price of the cost that you have contributed and what your pharmaceutical company has contributed reach $4,700. You then leave the donut hole and go into catastrophic coverage. You simply pay $2.60 for generics and $6.50 for any brand name drugs, or 5%. Most of you will never leave the initial coverage phase. Golden Gate Bridge has also provided help for you in the donut hole. So if you know ahead of time that that is something that you're going to be involved with, make sure that you call Golden Gate, and they are going to provide additional funds for you during that donut hole. Now this is confusing, but I want you to know that when you call our benefit advisors, one of the reasons we ask for your prescription drug coverage is because our benefit advisors can tell you if you will reach the donut hole. If you do, what month you will reach it, and the price that you will pay during the donut hole. They will explain these tiers again to you, and so you'll understand it a little bit better. And don't forget, Golden Gate is there for you if you need additional help, and that is the one time that you will need to phone Golden Gate. Otherwise, if you have any needs starting September 1st, make sure that you call Extend Health and talk to one of our benefit advisors. Now you're going to have an insurance premium. How do you pay that? You must make that insurance premium to the insurance company that you choose. Now you can make the premium payment by check. You can set up an automatic payment from your checking or savings account, or you can set up a credit card payment with the insurance company. If you've not received information from your insurance company and quite a bit of time has gone by and you get concerned about it, please call Extend Health. Some of you may have TRICARE or VA coverage. If you do, you may qualify for a waiver from enrolling in a prescription plan. Please let your benefit advisor know if you have TRICARE or VA when you call Extend Health. Please note also that if you qualify for a waiver for a prescription drug coverage and you want to enroll in a coverage later, you will need to wait until the open enrollment period, which is each year, October 15th to December 7th. And that's when you can make any changes you wish. Now, what is a health reimbursement account? That is used to reimburse you for your eligible health care expenses. It is a tax-deferred account. You must meet Golden Gate Union Coalition retiree eligibility requirements to qualify for this health reimbursement account. You also must enroll in medical and prescription coverage through Extend Health to be eligible. Your health reimbursement funds will be available on September 1st of 2012. You need to call Extend Health to enroll into your new coverage, and that will open your HRA coverage and plan. Now, how exactly does it work? You work with Extend Health to enroll in your individual coverage. Golden Gate Bridge allocates your benefit dollars to your health reimbursement account. You will then submit a claim to Extend Health. Extend Health reviews that claim and then reimburses you for your eligible health care expenses. This slide is another way of looking at the same process. First of all, you must make those premium payments directly to your insurance carrier, or enroll in a plan that provides automatic reimbursement. This is a little diagram on how to file a paper claim. First of all, you will need to make your plan premium payments. Then you will need to fill out the claim form and attach your proof of payment to that and send it to Extend Health. Extend Health will verify the receipt and then reimburse you. Now, how do I submit my expenses for reimbursement? I suggest that if it looks a little bit confusing, we have an excellent customer service department that would be happy to assist you in filling out your first reimbursement form, your claim form. You then need to attach a copy of the receipt or the invoice to your claim form and submit that. That document needs to have the name of the provider, the name of the patient, your name or your spouse's name, a description of your service, the date of the service, and the amount that you paid or owed. You then submit your claim form and receipts for reimbursement. You can fax them in, you can mail them in, or you can even go online and do it through a website. Now, this is a copy of our claim form, and I wanted to show this to you so that you could see that it really is a very simplified form. And at the very top of it, you have our address if you want to mail it, or our fax number if you want to fax it in. And just as a reminder, don't forget, right down there on the very, very bottom, that line where you sign and date it before you send it in. Now, how fast will I get my money back? If you fax it in and request a direct deposit into your account, it's a maximum of 5 days. You can sign up for a direct deposit online or by returning the direct deposit deduction form that will be included in your welcome packet that you'll be receiving from Extend Health. Now, what is automatic reimbursement? We've talked a little bit about it. Well, it's a service that's offered by Extend Health. We've gone to each of these carriers and we have made arrangements with them so that they will send us a file each month that indicates that you've made your premium payment. Because they send us the information that indicates those premium payments have been made, you don't have to file a paper claim form. They will send us the file, we review it, and then we will reimburse you. Automatic reimbursement is not available on all plans. You need to talk to your benefit advisor. If this is something that's important to you, make sure that you choose a plan that does have automatic reimbursement. Make sure that you call Extend Health. Again, our number is 888-232-1624. Now, this is how automatic reimbursement works. You simply make your premium payment to the insurance carrier. The insurance carrier then forwards a receipt or a file to Extend Health indicating that you've made that premium payment. Then Extend Health, once they have verified that receipt, they will simply reimburse you. One important note that I want to point out about automatic reimbursement, because while it is certainly the easiest way to be reimbursed, when you first enroll, it is not necessarily the fastest. You need to allow up to 3 billing cycles for automatic reimbursement services to be set up between Extend Health and the carrier. It works extremely well once it starts, but there is a little bit of a lag time. Now, plans that do participate with automatic reimbursement, you can see that we have many of them. Plans that do not participate in your area with automatic reimbursement is Blue Shield of California. Now, what happens to those HRA funds if they're not used at the end of the year? Well, the good news is this: they'll just roll over and you can use them the next year. Unused funds that roll over from one year to the next. Your allocation in 2012 is $4,208. That is prorated for 4 months. So, because you are enrolling with your effective date of September 1st, this year you will receive $1,402.67. If you submit a claim that totals $1,000, the claims are paid, and that will leave $402.67 in the account. That amount will roll over, so you will have $4,602.67 to be reimbursed in the new year. Now, what if you have claims that are more than the amount of money that you have available? So roll back. Your allocation in 2012 would be $1,402.67. That is the prorated amount. If you were to submit a claim for $1,500, the $1,402.67 is paid from the allocation, and that will leave $97.33 as pending until the allocation in 2013 to the participant is your standard $4,208. Pending amount $97.33 will be paid to the participant. You will have a balance for 2013 of $4,110.67. Extend Health is your advocate and your support during this process. We have a toll-free number that is dedicated to Golden Gate Bridge retirees. We have a direct support for claim issues, appeals, and network questions. And there is ongoing enrollment services as retirees or spouses turn 65. Now, the next steps, what you need to do is review your enrollment guide, simply call Extend Help.